Right. So this is just to put a disclaimer out there that this is for mental health education purposes only. This is for education purposes only, and that this is not a personal consultation by any means. So we've done our due diligence to make sure that what we provide tonight is up to date and it's comprehensive and it's accurate. However, this is not a personal consultation by any means. So should anyone want to take personal decisions, please consult with your healthcare provider, which could be your consultant psychiatrist, your psychiatric nurse, your whoever it is that is, or your psychologist, or whoever it is that provides your mental care. And also to be aware that this event is being recorded. Should you not wish to be recorded, please just switch off your camera, and you can use a pseudonym. Feel free to do that, and of course, feel free to switch on your camera if that's what you would like to do. I think that's all I have to share now. When I come back later, I will come to share with you the details of the different with the details of the different things that we've got lined up in terms of the WhatsApp groups. So with that in mind, I'm just now going to stop sharing, and I'm going to introduce to you our very eminent guest facilitator for tonight. It's really a great privilege to have Dr. Bayo Anjorin in our midst this evening. Dr. Anjorin is a good friend and a very much cherished colleague. He is a fellow of the Royal College of Psychiatrists in the UK, and is also a consultant psychogeriatrician. So that means he is a psychiatrist who takes care of older people who are over the age of 65. Dr. Anjorin graduated from as his medical degree from the University of Jos in Nigeria, and where he obtained his Bachelor of Medicine and Bachelor of Surgery degree in June 1991. He is an elite doctor because he worked soon after graduating. He worked at Aso Villa, which people who are from Nigerian origin will know that means that he was treating the president at the time. And he then came over to the UK, where he passed his PLAB exams. And before doing that, he has had many years of investing into healthcare, particularly of the elderly. Before doing that, he worked actually in taking care of elderly people in the various elderly people's home. And he then went on to become a registered medical practitioner in the UK, and then worked in the accident and emergency before he pursued a career in psychiatry. And he obtained his membership of the Royal College of Psychiatrists in 2003. That's about 22 years ago. And went on to specialize in old age psychiatry, becoming a consultant in 2010, which is 15 years ago. Dr. Anjorin holds various academic qualifications and has co-authored over 40 publications in peer-reviewed medical journals. He has also served as an inpatient consultant psychogeriatrician with Berkshire Healthcare NHS Foundation Trust for the past 13 years, caring for elderly patients with severe dementia as well as complex medical and psychiatric conditions. He has held several leadership roles within the trust and has trained over 50 doctors. In recognition of his significant contributions to mental health services, Dr. Anjorin was awarded a fellowship of the Royal College of Psychiatrists in 2023. He is happily married with 3 children, 2 of whom themselves are practicing medical doctors in the UK. And he hasn't said that, but I do know that one of them is actually dually qualified, both as a pharmacist and as a medical doctor. So when you see Dr. Anjorin looking that young, don't be fooled by the good looks. He's got 3 children, and he is a Christian leader. So please, with your clapping emojis, let's make Dr. Anjorin feel very welcome to Tripart Care Emotional Wellbeing Hub. Thank you, Dr. Anjorin, for joining us. It's really a pleasure to have you here.
Thank you so much. My family came to my rescue.
Thank God for family.
To have younger people around you, they will always fix things. So I really want to say thank you. I just want to say a very big thank you to you, Dr. Ajayi, for all the good thing you've been doing. I really want to, I just feel encouraged and how much you put in, especially in the area of mentoring young people into medical school. I really want to say thank you. I also want to say a very big thank you for all the wonderful work you'll be doing, especially in championing the mental health, even among the ethnic minority. And I also very grateful that you were handsomely rewarded with the Fellow of Royal College of Psychiatrists for what you've done in terms of public speaking, promoting mental health among ethnic minority, which is something that I equally have passion for. Today, I'm just going to quickly share my slides so that we can get straight to the what we're here for. If I just quickly check. Okay, I'm not sure if anybody can see my slide.
Yes,
we can.
Yes, we can.
Okay, so today we're just going to be looking at dementia, preserving your brain for older years. Preserving your brain for older years. And this is actually in reflection of what Dr. Ajayi did last time. Because Dr. Ajayi spent a lot of time talking about, let me see if this slide can move. Dr. Ajayi spent a lot of time last time talking about how what we can actually do in terms of ensuring that we keep our brain functioning very well. So it is a very nice time to actually looking at how what we could do to preserve our brain for older years. I'm just having a bit of issue with my slide not moving. Let me just try and see if I can. There seems to be a bit of. Sorry, I'm just trying to see whether my slide can move. If not, I will just, before I start.
Yeah, it's fine. Yeah, sometimes Zoom can be an interesting place. Okay, good,
Okay.
brilliant, good. Yeah, we
So
can see
I
that.
think I find a way of going around it. Again, thank you for helping me out here. Okay, so what we're just going to do is mainly to educate ourselves about dementia, what it is, the type, the different type of dementia, the causes, the preventative strategies, and how to support those who are affected. And Dr. Ajayi has already made a disclaimer. I'm equally doing the same thing. I'm just going to do a quick disclaimer. I'm going to use a motor car analogy. I will explain what that means. We're also going to introduce the topic. We're going to look at what is dementia, the type of dementia, and so on and so forth. And we're also going to be spending quite a lot of time on prevention, the intervention, the tips for carers and family of those who suffer from dementia. So the disclaimer, it's always good to say this disclaimer. This presentation is for educational purpose only. It does not replace medical advice or professional diagnosis. If anybody, maybe after listening to this, what we are saying today, have concern about dementia or the loved ones, maybe with memory issues, without any element of anxiety, they should just consult a qualified healthcare provider who can then help to make a diagnosis of the condition. The information is purely based on my professional experience. I also did a well-resourced reference, which I will also put at the end of the presentation in case people want to read a bit further. I have to say that I've not been paid to give this talk. So I'm just going to quickly talk about the human body like a motor car. I think this is going to be very helpful so that when it now comes to the prevention, how to prevent, how to help, and we'll be able to understand where I'm coming from. So if let's look at human body as a car. Just let's look at it. And then let's look at the engine as the human brain, and then the battery as the heart. The brain is actually the engine that controls, that directs and power everything. And whereas the heart is the battery that provides the vital energy through blood to start and sustain life. And so just as a motor car, the engine and the battery, they're actually codependent. So we should also look at the heart and the brain as equally codependent. They all work together. Just as the car battery powers the engine to start the heart by sending oxygen, that is oxygen, nutrients to energize the brain, so also when you turn the car ignition, the battery deliver a high surge of current to start the car. And then you hear this cracking noise, and then the engine just go into action. Similarly, from the moment of birth, the heart ignites life by constantly supplying the brain with blood. And this blood will be rich in nutrients, of course, will be rich in oxygen. Once the engine, which is the brain, once it starts running, it does not sit idle. The engine then powers the alternator, which recharge the battery and runs the car system, including the light, the sensors, the computer, everything in the car. Likewise, in the body, the brain actively regulates the heartbeat, the blood pressure, the breathing, and even emotional rhythm through nerve supply and hormonal signals, therefore helping to maintain the health, the health of the heart in return. So thus, you can now say that the heart sustains the brain and the brain sustains the heart. So what happens when one fails? If the battery, which as I already mentioned, represents the heart, if it fails, the engine, which is the brain, cannot start. Likewise, without the blood, brain cells begin to die within minutes due to lack of oxygen and energy. If the brain, which represented by the engine, fails, even a healthy battery, that is the healthy heart, cannot properly function. So that's why when somebody has severe brain injury or people have neurodegenerative condition like dementia, it's a matter of time. You could actually see the regulation of the heartbeat, the breathing begin to be affected, the blood pressure begin to affected, and that subsequently lead to failure. So in both cars and the body, failure in one system quickly endangers the other. So you will see the relevance of this when I start talking about it. So the bottom line is that you can replace part of the car, but in the body, the brain heart partnership is irreplaceable. You can't just put in a new brain. You can buy a new engine. So that is why it is very, very important that we maintain both the brain and our heart system. And because we know that they constantly communicate, and because of the communication between them, and that leads to the body functioning well. So damage to one inevitable harms the other. So a healthy living is like a good car maintenance. So when we talk about brain, we also need to talk about the heart. I really want to be thankful because I know my professor, my lecturer in university, when I was in teaching hospital in my house job, Professor Balogun is here. I'm sure that he may have one or two things to tell us. Therefore, measures to keep the heart healthy, such as exercise regularly, eating wisely, stay mentally active, go for health check to make sure the blood pressure is under control, is actually good to maintain a healthy brain. So I think it's just good for me to just lay that foundation before we start. Okay, so I'm just going to give a very brief introduction because this is very, very important that I do this. Dementia is a public health issue. I think we need to understand that it's a public health issue. Why is it a public health issue? As life expectancy increases globally, dementia is becoming more prominent, is becoming more prevalent. When I started my career, I was with the dementia rates, the incidence of dementia in UK was about 570,000 then. And we were told that by the time we are approaching 2020, 2030, the sufferer of dementia will be approaching 1 million. And I could say to you that the figure is about 923,000. So we're just a few thousands short of 1 million. So you could see the projection was actually right. Because at that time, I was thinking in my head, that was when I started my career. I was thinking in my head, how can this be possible? How can the figure almost double even in my lifetime? And I could see it's quite evident now, because just few years down the line, we see ourselves clocking 1 million sufferer of dementia. What about worldwide? Over 55 million people worldwide actually live with dementia. And there are nearly 10 million new cases every year globally. Dementia is also considered as the seventh leading cause of death globally. It's also one of the major causes of disability and dependence among older people. But the good news is that with proper education, we can work towards preventing it. And that's the basis of this talk. Early detection is very, very important. And even when people develop dementia, compassionate care should be the key. Compassionate care, that word is very important. So the human brain, I actually took this slide for Dr. Ajayi lecture. I'm just saying that the dementia is a public health issue. And I also mentioned that as life expectancies increase globally, dementia is becoming more prevalent according to the World Health Organization. I did mention that dementia is actually a public health issue, in the sense that over 55 million people worldwide actually live with dementia. In the UK, the incidence of dementia is rising. And I did mention that when I started my career, that's about that was less than 20 something years ago in the old age psychiatry. The incidence of dementia was said to be about 570,000. And it was also projected that before 2030, the incidence of dementia will go up to 1 million. And I'm saying that we're just a bit short of that figure, just a few years down to 2030. I also mentioned that there are nearly 10 million new cases of dementia globally. I also mentioned that it's one of the major causes of disability and dependency among older people. And I'm saying that with proper education, we can actually work towards prevention, early detection, and also compassionate care. So the next slide is just quickly talk about the human brain. So if you just move to the next slide. The human brain weighs about 1.5 kilogram, and yet the brain is said to be a very complex organ. I also did mention that the brain is very sophisticated, even than the most advanced computer system in the world. I also mentioned that the brain coordinates all the body cells and organs through a very complex electrical and neurochemical system. As Dr. Ajayi shared in the last talk, the brain contains about over 85 billion neurons and almost the same supporting cells. And the brain also have 100 trillion connections between the cell. So it is very, very important that I mention that. And the next slide, although the other slide is with me, which is the brain function. I'm just going to, if you look at just keep this slide on, the front part of the brain is called the frontal lobe. That frontal part of the brain actually helps with movement, with behavior, with problem solving, and also with speech. It is very important because when we now come to types of dementia, that will be able to help us to be able to maybe to look at various types of dementia. And then when you look at the other side of the brain, which is called the parental lobe, which is the, let me just say, I'll probably send this slide to Dr. Ajayi so that people can actually see. It's already on my slide, but
yeah.
So let me just quickly explain that the frontal part of the brain control movement, behavior, problem solving, and speech. And there's a part of the brain called temporal lobe, which is the one below the front part of the brain. And this actually controls language, memory, hearing, emotions. And then we also have a part of the brain called parental lobe, which actually help with intelligence, language, sensation, reasoning. And then we also have part of the brain which also help with sight, with visual perception, and so on and so forth. And then we have some part of the brain called cerebellum, which also controls the balance, the muscle control, and then the brainstem, which actually controls the breathing, swallowing, and the rest of it. So any part of the brain can actually be affected. And the part of the brain that is affected will actually dictate the type of dementia that we are dealing with. So I think that's very, very important that I put that in. Okay. I'm also going to look at the brain function based on the damage to the frontal part of the brain. Definitely should affect intelligence, judgment, and behavior. And then damage to the temporal part of the brain, which is the one below the front part of the brain, will affect memory, and they're also going to affect especially new learning. And then part of the brain can also be affected. Language can also be affected when a particular part of the brain is affected, which is the parental lobe. This thing might not make a lot of meaning, especially to people, but it's just important that I mention all these things. Okay, so I'm just going to go into what is dementia. What is dementia? Dementia is not a single disease, but it's a general term that actually describes a group of symptoms associated with progressive decline in memory, in thinking, in behavior, and also ability to perform everyday activities. So that's why you could also expect people with dementia, it can actually interfere with their activity of daily living skills. Dementia tends to affect people over the age of 65, although it's not a normal part of aging. The reason why I'm just stressing that, because you could see people actually arguing that it's automatic, that when people have dementia, when people age, you expect them to have a memory problem. But I have to say that I could confidently say that we should not just assume that dementia, yes, it's common as people get older, but there are quite a lot of elderly people. There are quite a lot of elderly people who actually have well-functioning brain. So I think it's very important that I mention that. The other key features of dementia is memory loss, especially short-term memory. We also have difficulty in communicating. Finding the right words is usually most of the main problem that people often start the beginning of the process, because people will first of all say to you that I'm actually struggle to find the right words or even following conversation. That will indicate that the memory is failing. And the other important thing is impaired reasoning and judgment. Especially people might have struggle with decision making. The people may also suffer with change in mood or personality, which sometimes we refer to as apathy, and irritability, depression, and sometimes people with dementia will actually present with psychotic symptoms. So you could see people hearing voices and seeing things when things are not there, and so on and so forth. I think that also depends on the part of the brain that is affected. These symptoms vary according to the type and stages of the dementia. So that leads us into, because I've just only just given the snapshot of the most common one. And then let's look at the type of dementia, because that I think we could then build up on that. The next slide, please. The type of dementia. The Alzheimer's disease is the most common one. It actually accounts for 60 to 70% of all dementia cases. It is actually caused by buildup of plaques, which we also refer to beta amyloid. That's just the medical term for that kind of protein. And also, they also build up of, we call it tau, which is tangles within the brain. And what this does is to affect the conduction, because as I mentioned before, I said the brain has a lot of connective tissues and there are a lot of connection within the brain. So anything that affects the flow of those connections will actually impact the function of the brain. So in this condition, there's also buildup of plaques, as I mentioned before, this abnormal protein in the brain. And usually symptoms develop gradually because this is a long process. And that's why people will say to you that their memory is failing. And the family will say something like, they tend to forget here and now. And people will they will just say that they notice that over a period of time, they may say to you that over the last 6 months or even over the last couple of years, they notice that there's been gradual deterioration, especially in short-term memory.
All right.
And that's usually typical of the Alzheimer's type of dementia. The other type of dementia is vascular dementia. This is actually caused by impaired blood flow to the brain. This is often due to stroke or even mini stroke. And that's why when people have TIA, that's a transient ischemic attack, which we refer to as mini stroke. These are the kind of things that could actually lead to vascular dementia. This is the second most common type of dementia. It accounts for 15 to 20% of cases. And I think that's where there are a lot of discussion on controlling blood pressure, controlling blood sugar level, controlling cholesterol, because these are the things that are actually predispose to this kind of dementia. So if you put in preventative measures to actually reduce the risk of all these conditions I've just mentioned, you're actually reducing the incidence and the frequency of vascular dementia. And as I mentioned, the other type of dementia is Lewy body dementia. This is associated with abnormal protein, which we call Lewy body. So, and how the diagnosis, usually the diagnosis is quite difficult because the CT scan will not be able to show all these things. It's only a special kind of scan that you can actually see all these things. But when you do the postmortem and the characteristics of what you see is this what is described as Lewy body, the characteristics of how the thing look like. This type of dementia is also associated with Parkinson's disease. Sometimes people think they are actually the same, they share the same pathology. And people with this kind of dementia usually have what we call visual hallucinations. They see things, They may see things when something that nobody else can see. They also suffer from movement disorders, which is also, as I mentioned before, it also shared is almost similar to Parkinson's disease. And sometimes they also have sleep disorder as well. The sleep disorder the sleep disorder could actually be the reason for referral of patients sometime. And then subsequently, you might begin to see other part of the features. There's also one which is called frontotemporal dementia. This tends to affect people under the age of 65. This affects the frontal and the temporal lobe of the brain, resulting in behavioral changes. It also tends to affect the speech, as already mentioned, because the speech area is around the frontal lobe. It also leads to emotional problem. It could be emotional dullness. It could be arousal, where the patient is very, very outraged. They become quite disinhibited. But the behavioral changes is usually the first thing that people tend to notice. And then subsequently, the memory loss might now become more apparent. So when you notice a behavioral change in somebody, when people begin to say that their behavior has changed, they are no more themselves, it's always good to try to find out what is causing it. And then sometimes the CT scan will actually pick up these changes in the brain. And also there are a lot of tests that can be carried out, which can also help in the diagnosis of frontotemporal dementia. The other thing which I also mentioned is the one that is quite common, is a combination of two or more types of dementia. Usually the Alzheimer's and the vascular dementia, the combination of the two, and it's estimated that between 10 to 20% of older adults will actually have this kind of mixed type of dementia. So also looking at the causes of dementia. The first thing I just need to say is that aging is the single biggest risk factor. With aging population, the incidence is also expected to rise. Here, the incidence of dementia, I'll just quickly show a statistics on the, I think that's on the next slide. If you just, and then we can always go back to the slide again. So if you just look at the next slide, the single biggest risk factor is aging. Yeah, that's the slide. If you look at the incidence of dementia by age, based on current data from the WHO, World Health Organization, and other reliable sources, we could actually see that the incidence, the new cases per 1,000 people tends to be almost double as every 5 years. So that by the time you reach the age of 90, the incidence of the new cases can be up to 45 per 1,000 people. In the UK, it is estimated that approximately 1 in 14 people over the age of 65 have dementia. And this increases to 1 in 6 for those over the age of 80. Hey. So these statistics highlight the strong correlation between advancing age and the likelihood of developing dementia. So what is just going to say is that risk tends to double approximately every 5 years after the age of 65. So that makes age a very important factor when it comes to developing dementia. And of course, it's also important to say that quite a lot of elderly people have good memory without the suffering from dementia. So if you just go back to the slide again, we also look at the second important factor when it comes to the causes of dementia. The other important factor is genetics. Family history of dementia increases risk of dementia, especially when it comes to the early onset dementia. The term early onset dementia is actually dementia for people suffering from dementia, people below the age of 65. And that is, this are referred to as early onset dementia. Family history tends to be very more important in this group of patients. It's not to say that other people as well, if also other people can also be, because there's a particular gene which can be positive in people with dementia. But just for us to just know that it's also an important factor as well. The most important cause, which I've already kept mentioning, which we can change, is the cardiovascular issues. High blood pressure, diabetics, stroke, high cholesterol, and also lifestyle, such as smoking, poor diet, physical inactivity, are also very important. And these are the factors, things that we can actually change. They are also important causes of dementia, especially even not just vascular, even Alzheimer's type of dementia. As already said in the beginning of the lectures, that the brain and the heart are they have many things in common. So if you're trying to maintain one, you're actually maintaining the other. The other thing is head injury, particularly repeated concussions, and also various hazards to the brain can actually lead to dementia eventually. There's also some other causes which we could say they are preventable. You can actually do something about them. Maybe things like infection, HIV, any form of encephalitis. They can actually contribute to cognitive decline. So that's also very important that we stress that. Okay, so about the causes, let's now go to prevention strategies, which is the next slide here. If we mention that, if you look at we say lifestyle is very, very important. So how do we prevent it? What can we do to reduce our chances of the incidents? What can we do to reduce the incidence of dementia? Regular physical exercise. This is said to lower dementia risk by up to 30%. The other very important lifestyle measure is healthy diet. And I know Dr. Ajayi spoke about Mediterranean style diet, which is said to be rich in fruits, in vegetable, whole grain, and fish. They're also said to lower the cognitive decline. We actually have people that did not attend the March lecture to actually, I think Dr. Ajayi will speak about that. There's quite a lot of information, which I think is pointless for me to repeat everything. Cognitive engagement is also one of the preventive strategies. And this includes lifelong learning, doing some puzzles, reading, learning new languages, and so on and so forth. Anything that keep the brain going, because if you exercise the brain, we're actually helping the neurons and also the connection in the brain. The other very important factor is social interaction. Loneliness and isolation are major risk factors. The preventative measures, which might be secondary prevention, is management of chronic conditions such as hypertension and diabetes, and also other medical conditions, high cholesterol, and so on and so forth. Avoiding excessive alcohol and smoking, both could actually reduce dementia risk quite significantly. The other very important factor is rest and stress management. Mental exhaustion, poor sleep, and stress is not good for the brain because they actually make it harder for the brain to recover from everyday wear and tear. Once somebody is born, the brain continues to grow until the age of 25, and subsequently, the brain now begins to age. And the wear and tear is quite common. It's just like a vehicle. As I already use the vehicle as an example, you will expect the normal wear and tear. But however, to keep it in minimal, you regularly service the vehicle. And you also avoid putting so much load on the vehicle. The vehicle should be allowed to rest. And also the vehicle needs to be regularly ensured that the vehicle is not overworked. So stress tends to overwork the brain. And it also causes inflammation and damage to the DNA in cells, which in turn can accelerate the brain aging. Poor sleep can actually lead to increased development of a toxic protein in the brain, which is called the beta amyloid. The beta amyloid I mentioned before, which begin to accumulate in the brain as the people begin to age, especially as part of the disease process in Alzheimer's type of disease. So poor sleep can actually increase the development of this toxic protein. So what I'm just saying is that up to 40% of dementia cases may be preventable, and we could actually reduce or even delay the development of dementia through these modifiable risk factors. So I think that is very important that we stress that. Dementia interventions. It's just important for me to just mention that in case somebody has developed dementia, it's just very quickly, I've just mentioned, because people will say that they hear there's some medication that could help to treat dementia. This medication are usually used just to reduce the progression of the disorder. That's the next slide. This medication, I've just mentioned the most common one, everybody will know, Aricept, which is donepezil hydrochloride. I think that's the most common one. They're actually used for mild to moderate Alzheimer's type of dementia, in the sense that they slow down it's expected that they slow down the progression of the disorder by some few years. Although I have to say that even with the medication, the process will continue until eventually most of the brain function is lost, unfortunately. And the rate of deterioration is usually people, if you look at most textbooks, there's no fixed number. People will say between 5 and 20 years. It just is a very habitual number. But medication could actually reduce the rate of deterioration. In some patients with quite severe dementia, this patient tends to develop behavioral and psychological symptoms. The behavioral symptoms which we usually notice is agitation, very out of character. Somebody might develop aggression, wandering aimlessly, and this can be very, very, very severe. And this often leads to carers' burdens. The reason for admission, most cases, is because of the behavioral symptoms. People can manage somebody who is confused, who has memory problem. But when the sufferer now begins to be having challenging behavior, aggression, agitation, constantly walking around, wandering, and they can't actually put themselves at risk. So this could put a lot of burdens and actually on the carers. And although I will later talk about what we could do to help how we could support the carers later on. And for those patients, you may have to use medication like memantine, which tends to act on the particular part of the brain to actually modulate some of this behavior. And sometimes we may have to use antipsychotic medication, because I did mention that sometimes some patients with dementia will actually have psychotic symptoms. They could start hearing voices, seeing things, and this can be quite distressing. And sometimes use of antipsychotic medication, although they do have side effects, it's usually done with trying to manage the risk and benefits. That seems to be the way to manage such situations. So if you don't give medication, if you feel that the patient are going to put themselves at significant risk, you may have to argue to give medication and then closely monitor and start a very small dose of medication and then build it up over a period of time. And that's the most reason why patients get admitted, especially to my ward where I work. It's also very important to say that we need to treat coexisting conditions such as depression, sleep issues, or infection, because all these things will actually happen because, as I mentioned before, coexisting, people may have even coexisting conditions before they develop dementia. And even some studies have shown that depression is quite common in people with dementia. Sleep issue is also a very major problem in dementia as well. As I already mentioned, that sleep deprivation or lack of sleep also have a very negative impact on the brain. So it is very important that we also manage sleep difficulty in people with dementia. Then I'm just quickly going to therapeutic interventions. These are very, very important that I mention this. There's something called cognitive stimulation therapy. I think that's the next slide, please. Cognitive stimulation therapy. This actually involves a wide range of activity that aim to stimulate thinking. It also helps memory. And these activities may include discussion of the past and present events, especially topic of interest. Even some people may want to do word games, puzzles, music, practical activities, maybe learning new things, gardening, baking, any sort of things really. Especially if it's new learning, because we know that new learning helps the brain to grow new cells. It also helps to improve the connections, as already mentioned before. And the cognitive stimulation therapy is usually delivered with a group of 4 to 5 people who are living with dementia. Why we tend to use groups is also going to help social stimulation. Socialization also helps the brain as well. So having it in a group setting is usually opportunity for sufferers to share their experience. And this tends to work well when people are at the initial stage of the condition. And the system is usually run by, the group is usually run by a trained psychotherapist or psychologist, occupational therapists, nurses, and even doctors, because when I was during part of my training, I actually run some of these groups. And the group usually lasts for 30 to 60 minutes, and usually at least twice a week. And then you run it for over a period of time. If you look at the literature, there's evidence to show that people living with dementia tend to benefit quite a lot from this. The evidence has shown, firstly, it enables them to understand the condition. Secondly, it also enables them to relate to other sufferers of this condition. It also makes them to be able to master what is best for them. And some people find mental activities stimulating. Some people prefer to use their hands. It's just discover what is best for individual. There's also evidence to show that shows that people living with dementia who undertake word or number puzzles frequently show better performance across all the cognitive area. And when it comes to memory, they tend to do better. When it comes to thinking, when it comes to reasoning, when it comes to attention, when it comes to organizing and planning, they tend to do better than people who doesn't engage in any of those activities. The other things that could be done is also called reminiscence therapy. Reminiscence therapy is using photos, music, or objects from the past to actually evoke positive memories. It's using subjects of the past to evoke memories. So this is the reason why this is very, very important is that people tend to relate better with their past. And also keeping somebody's memory on, keeping them on, making them to connect with their identity is very, very, very crucial when it comes to managing the condition of dementia. Occupational therapy also play a large role in helping individuals manage their daily tasks and maintain independence as long as possible. Because the aim is to keep people going for a very long time. And you don't say because somebody has dementia, you just take over their life. You try to support independence as much as possible. And that is the role of all the other professionals like occupational health, all the supportive system. The supportive system will include attending the memory clinic, where there's going to be some discussion about how to help somebody to carry on with their memory, what the memory enhancement method, teaching them about various other techniques. They may have to look at new learning, and all those things do help. You also have daycare that also do a lot of activities, which will also stimulate the brain as well. And then sometimes you want to keep people in their home as long as possible. But because of their, as I already mentioned, it's not just the memory that is affected. It also affects decision-making, planning, paying the bills. And that's where dementia sufferers may actually need help. They don't necessarily need to go to care home. They can actually receive all the support that they need, even in their own homes, with all the support system. The other thing I also mentioned is that I said carers' stress is the main reason why dementia sufferers get admitted to the hospital, because the carer will just, they feel so stressed, and it's understandable. And that's where there's what we call respite care. So it's a place where people can actually be looked after, maybe sometime it could be done maybe a week. I think what I was saying before, I was just talking about the various things that could help. And I think I've just touched on the respite care, that sometimes you need to keep people in their home as long as possible. So supporting the carers might be one way of doing that. Counseling is very important for both the patients and the carer to be able to manage stress and emotion. Also, it will also help emotional well-being, because understanding the condition itself, what will happen over a period of time, is going to be quite helpful, really, in terms of educating people on the best way to go about the condition. The next thing is tips for carers and family members. I have to say that caring for somebody with dementia can be both rewarding and challenging. Because I did mention about compassionate care earlier on. I really stress on compassionate care. Patients tend to benefit quite less, and many sufferers of dementia tend to benefit from compassionate care. They do understand when they could read body language. They could see somebody that is stressed. They see somebody that is think they are burden onto them. They could actually read all this body language. And don't be surprised, even people with moderate to severe degree of dementia will actually read body language. So I think that's where educating the carers is very, very important. I started on my working in UK, looking after the elderly people. I just want to reflect on that. I think that also affected my choice of career. I will remember holding their hands, telling them that what they did during the Civil War, because the British, because at the time when I came to UK newly, so quite a lot of, because the generation that fought the war, they're almost gone now. But I'm talking about maybe 30 years ago. So majority of them actually fought the Civil War. So I would kind of strike a conversation because their long-term memory is usually preserved. I will kind of strike a conversation that, tell me what happened during the war, how you people fought. The freedom we are enjoying today is the hard work of you people. Tell me a bit about it. And you actually see the smile. You will see the joy. You will actually see the person, you will see them coming alive, telling you story. I also remember when we used to have group session, and then the group session we play old music, the music of the 60s, and you see them dancing, enjoying themselves. And then you could see the joy of we carers bringing smile to the sight, to the face of somebody who actually suffer from a very serious condition. At the same time, it could be quite challenging because the same patient might just change suddenly without any warning. They might become very aggressive suddenly, unpredictable behavior. But what tends to help is maybe talking about it, is asking family what tends to make them feel happy. What sort of things are they enjoying doing? What sort of conversation did they like engaging in? Are they the people that like choices? Are they people that they will prefer that you offer them choices? Do you prefer to have your medication now, or do you want to have it later? Especially based on their personality. Some people don't want to be told it's time for meal. Some people want to be told, oh, is it? Do you want to have your meal now? Everybody seems to be having their meal. Do you want to have your meal? I think that's where communication is very, very important. We also need to use simple language. We may need to repeat instruction and not shouting, because sometimes when people shout at because of where sometimes people lose their patience, it can be quite disrespectful. Politely, and sometimes it's good to just explain that I'm sorry, I may have to repeat myself. And sometimes I make joke, you could even make joke of it. You could even make joke of not in a very what you call now, patronizing way. You could just say, oh, I'm going to repeat myself again. I'm going to repeat myself just in a nice way of putting it across. As I mentioned before, non-verbal cues, facial expression, gesture can actually help. If somebody is genuinely caring for you, you will know. The body language will give it away. So it is very important, and this is kind of training that is usually given to carers. That yes, there may be points when you feel you overwork and the pressure is too much on you. Please and please do not show it in the presence of the elderly people, because then they begin to feel they are just there to waste space. Let them feel valued. Let them feel important. These are the things that actually help. Routines and structure. This tends to keep anxiety and confusion at bay. It helps a lot. Even if it's just one or two things somebody with dementia can do in a day, try as much as possible to maintain the same routines. And that's what the care homes is all about. The care center. Sometimes the care center will have various activities, and you could see the timetable that today we are doing this. The group is running this way, this today. And then on Thursday, the group is running this way. And that consistency can actually help. And then, of course, we also need to create virtual calendars. In our bedrooms, in the hospital where I work, we use a lot of virtual aids. So when it comes to the toilet, we don't put toilet, we actually put the diagram of toilets like a loop, just toilet seat. So you can actually see the picture of toilet seat. You know that that room is the toilet. So labeling things, it can be very, very good way of helping sufferer of dementia to continue to remain in their home environment for a very long period of time. We also need to create a safe environment, a very safe environment, making sure that the things are kept as safe as possible, and then make as little furniture as possible, so that the elderly people can actually feel safe in their home environment. That will include removing tipping things, because the risk of falls is even more increased in the elderly. We may even need to install safety locks. And nowadays we have telecare, we call it telecare, is using the technology to help elderly people to continue to remain in their home environment. It may even use tracking system sometime because of the risk of wandering. And then we also need to ensure proper lighting and familiar surroundings. So those are very, very important. And then both the sufferer of dementia and also the carers need to look after themselves. It needs to be drummed in. Most of the conversation will be, how do you ensure that you look after yourself? And even the carers need to take regular breaks, respite care. And we also need to make sure that they don't feel alone. The carers don't feel alone at all. Then for the sufferers, we also need to do a lot of things like legal and financial planning. So this will include making sure that everything is already, before they get to that stage, even at the early onset, you begin to have plan. You need to begin to make plans, and making sure that their financial this thing is secured. And will writing, financial planning, planning for funeral, and so on and so forth. And then sometimes we need to consider things like power of attorney. Also, the hospital tends to do care planning. At this stage in my life, this is what I want. With we call it respect form. This is what if I should develop this, if I should have cardiac arrest, I wouldn't want to be resuscitated. So all this planning is always good to do it earlier on, so that both the sufferer will know that at the end of their life, they will well look after. So I just want to quickly draw a conclusion based on what I've just said. Dementia is not a guaranteed part of aging. It's not a guaranteed part of aging. There's much we can do to lower the risk. Healthy lifestyle habits, physical, mental, and social, are powerful tools for brain health. Early planning and informed caregiving can help a great deal. So I just also want that the aim of this talk is actually begin to plan now, because if you begin to plan now, we can actually we can boost our brain health. We can also help us to preserve our brain so that we can carry on a very long time. And for those people who already develop dementia, we need to make sure that we continue to improve their quality of life. And we also need to support every one of us who at one stage are actually involved in the care of people with dementia. And that's why we need to stay informed. We also need to be very proactive. Thank you very much.
Wow. Thank you so much, Dr. Anjorin, for that whistle-stop tour of dementia. Really very pragmatic. I like the fact that you covered not just the symptoms and the features, but also how to support carers, and also preventative measures, what we can do now to make sure that our brains continue to serve us into our 90s and 100s and thereafter. So thank you very much for that. And I'm sure that there are some comments coming in already just saying thank you and appreciating that effort that you've put into that. So thank you very much. And I'm sure that the audience will also please join me in thanking Dr. Anjorin by giving your emojis. So I'm just going to go right. Okay. So thank you, everyone. And once again, Dr. Anjorin, thank you for joining us tonight. Have a good night, everyone. And we look forward to seeing you again on the 27th, 29th of May. So it's Thursday, 29th of May. We look forward to seeing you. Thank you, everyone, and God bless you. Have a good evening.
Thank you, Doctor.